Up to 1 in 15 female teens has POTS. Wow. Okay. So one of the things they found is that as people move into puberty or move out of puberty, I guess, for many, there are notable improvements in POTS symptoms. Does it mean that POTS is all gone, that you just, quote, grow out of it? No, not necessarily. Most people will have some residual symptoms and have to monitor their stress levels. However, symptoms do dramatically improve for a lot of people with POTS once their hormones aren't all over the place, hither and yon, like they are during puberty. However, 1 in 15 teen females, which means 1 in 15 females that are in high school and college, have POTS. That means 1 in 15 females who are in high school and college start to have some level of cognitive decline after about 20 minutes of sitting in class. So think about how that's impacting their ability to learn and their functioning on tests. People who have POTS do not do well if they have to take a long test like the ACT or the SAT because their cognition declines so quickly. People with POTS may struggle with driving or even riding in a car, but driving especially because you have to be mentally sharp and situationally aware when you're driving. But if your cognitive abilities start to go down after 20 minutes and you're driving the car, it can be really dangerous. And there are a lot of people with POTS who have recognized that it is not safe for them to drive more than, 2 or 3 miles up the street and back. And that is very paralyzing as an adult, as a, young adult, older teenager. That can feel very paralyzing and sometimes demoralizing. Recognizing that as a clinician, as a support person, and not making somebody feel bad for not being able to drive them around. There's a lot of guilt associated with POTS because people with POTS often feel like they're a burden. We'll get to addressing that in a few minutes. I've gotten off topic. The typical age of onset is between 12 and 19. However, as I said, some people can have onset into their 40s and 50s. Gender bias increases mislabeling POTS as anxiety in females and depression in males, leading to underdiagnosis. And I did mention ADHD and ADD before. Most of the time, the symptoms overlap with ADD more than ADHD. Most people with POTS are not hyperactive. They have everything they can do to keep going because just existing is exhausting. Most individuals with POTS have overlapping mechanisms going on. Hypovolemia, that means they have too little blood in their body. And that can be, for a lot of them, the hormones that we have in our body that are supposed to regulate salt and fluid levels to keep the correct amount of blood in our system. People with POTS, that system's on the fritz. So they often have difficulty regulating the amount of blood in their system. So they don't have enough, which is why one of the interventions that doctors will use, again, this must come from a doctor, not from us, is to tell people who have POTS to increase their salt intake as much as they need. Some people with POTS will even carry sodium pills with them to help manage their fluid balance. Venous pooling, we already talked about that. That's blood pooling in the lower extremities. Impaired cerebral blood flow. Blood's in the feet, it's not going to the brain. That's a problem. That is registered, all 3 of those are registered as stressors by the autonomic nervous system, which is going to keep that cranked up. We know when our autonomic nervous system is cranked up, we are not going to get good sleep. Our circadian rhythms are going to get disrupted. We're going to have more systemic inflammation. All these things we talk about with autonomic nervous system dysregulation and sympathetic dominance, people with POTS are going through. They may have autonomic neuropathy, where the body doesn't register as well what's going on with the heart and the blood vessels. They may have hyperadrenergic compensation. There's a type of POTS called hyperadrenergic POTS, which is characterized by the heart rate and blood pressure going way up, especially the heart rate when somebody stands. And their adrenaline and norepinephrine also going way up. They also may start flushing. It's almost like having menopause, God help them, when they are teenagers, because they stand up, all of a sudden they get hot, they start flushing, their heart rate's going like this. It's exhausting. And they have inflammatory and immune contributions. Because the sympathetic nervous system is in overdrive and there's not a break, because cortisol starts losing its ability as an anti-inflammatory, we see all of the things that we normally see with people who have sympathetic dominance, including systemic inflammation increasing in people with POTS. And it's just a worsening cycle. The worse the inflammation gets, the more the sympathetic nervous system's turned on. The more the sympathetic nervous system's turned on, the worse the symptoms get. Standing and extended sitting are both stressors. Upright posture, think about gravity. Upright posture shifts blood away from the chest and the brain and down into the lower extremities. Prolonged sitting, more than 15 or 20 minutes, such as in class, at work, or driving, also causes venous pooling, reduced venous return, so that blood goes down to the feet, but it can't get back up, and a consequent decline in blood flow to the brain. Sitting is often mistaken for rest when it is orthostatic stress in POTS. In POTS, sitting is not restful. If you're sitting, your body is still fighting gravity. Rest is being flat with maybe your feet slightly elevated. That's when your body can actually rest and go, okay, I don't have to it's almost like trying to suck a tennis ball through a straw, the way the body feels trying to get that blood back up to the brain. Brain fog occurs due to reduced blood flow to the brain and reduced oxygen delivery. We also know that when the sympathetic nervous system stress response is on, what's one of the first things that happen? Blood sugar, blood glucose, etc., are shunted away from the prefrontal cortex, where we do all of our executive functioning, our attention, our concentration, our learning, our organizing, our planning. All of that system basically shuts down and provides the blood sugar and oxygen and everything else to help us fight or flee. So when a person with POTS, that prefrontal cortex is really just struggling, screaming, hey, give me some energy back, which is why we see a lot of brain fog. It's as if they're in basically a persistent fight or flight state. We see slower processing speed. So in school or at work, if somebody has slower processing speed, they're getting it, but they're struggling. So instead of running the mile, they're walking it. We can't expect a person with POTS who is actively symptomatic to necessarily be able to come up with the answers as quickly. Things don't just roll off their tongue as easily because that prefrontal cortex is in a energy deficit. Reduced working memory. So things that they're learning start to go down. They start having trouble using their working memory. Executive dysfunction, attention, concentration, planning, organizing, out the window. Because the body says, you know what, we need to try to stay upright and keep the brain oxygenated and blood flowing, not really worried about learning algebra right now. And word finding difficulty. A lot of us have had this sometimes, especially if you've had particular viruses where you get significant brain fog, and it's difficult to find your words. It's difficult to think clearly. Well, this is what it's like for somebody with POTS 24/7.